Now, let's look what happens if we look at the sensitivities of a variety of diagnostic tests. For example, for carpal tunnel syndrome, sensitivity of EMG can be up to 86%, and actually, the specificity of the test can reach 98%. Look at the sensitivity of MSK ultrasound, 77, 78%. Of course, MRI can have a high sensitivity, but you cannot have an MRI in your physical therapy practice, nor you are able to perform an MRI in your PT practice and bill the insurance companies for the MRI and get paid for the MRI. However, you can do those with EMG and MSK ultrasound. And for other conditions, also look at the cervical radiculopathy that we looked before, 30% sensitivity of Sperling's test, but EMG is 71%. So very significant difference. So I'm going to show you real quick in a couple of different conditions how this plays out. Let's look, for example, without diagnostic testing, carpal tunnel syndrome. You have all of these various physical examination tests you can do, the thenar atrophy with 66%, Tinel sign, as I said, and Fallen sign with sensitivities and specificities as listed here. Meanwhile, with diagnostics, you can have a much, much higher sensitivity and specificity for these conditions. Look at cervical radiculopathy, the difference without any actual diagnostic testing more than the physical examination test, while with diagnostics, there are very significant sensitivities and specificities for the condition. And rotator cuff, look at that. Ultrasound, musculoskeletal ultrasound, and MRI are comparable in both sensitivity and specificity. In other words, you can literally replace an MRI for a rotator cuff tear condition with a musculoskeletal ultrasound. And the only difference is that the musculoskeletal ultrasound is at the point of care. You can do the testing in your office the moment you have the patient on the examination table. You can perform these tests. So very, very big difference.